To the pandemic now, and growing fears Super Sunday could become a super spreader. The U.S. reporting nearly 27 million COVID cases, more than 462,000 deaths. But there are some hopeful signs. Hospitalizations down for 25 consecutive days, and 9% of the U.S. population has received at least one vaccine shot so far. ABC's Trevor Ault is joining us live with the latest. Trevor, good morning to you.
Good morning, Whit. There are reasons to be optimistic about the direction we're heading in this pandemic. Just here in New York, the positivity rate has fallen back to 4.5% for the first time in 2 months. But this is still a heated and contentious fight. And especially with the Super Bowl tonight, health experts are worried we could easily undo this progress we've made.
This morning, the vaccine rollout slowly gaining momentum.
It's going to be a quick poke. Relax your shoulders, please.
CDC reporting more than 30 million Americans have received at least one dose, and about 2% of the country has received both shots.
Just thrilled to death. I couldn't believe it. I feel so blessed.
Now, most parts of the country are seeing positive coronavirus trends, though experts say it's too early to tell if vaccines are having an impact nationwide. And health officials are concerned tonight's Super Bowl could spark an explosion of coronavirus cases if Americans throughout the country don't follow social distancing guidelines. In California, 100 students and staff at a single San Diego County school district ordered to quarantine 2 days after restarting in-person learning.
I voted to, be able to come back and teach in person, but now I feel that our priority is for everyone to be healthy.
And the debate over bringing students back to the classroom has become a national flashpoint. In Chicago, home of the country's third largest school district, the mayor and the teachers union have been unable to reach an agreement on a plan.
We must reach a deal for the sake and sanity of our students, parents, teachers, and the hardworking employees in Chicago public schools.
And the uncertainty of the pandemic is weighing heavily on America's mothers. The New York Times reporting almost 1 million of them have left the workforce. Dakita Brown is still working while raising her 2 daughters, one of which has autism. She says she hasn't been able to rest for almost a year.
I'm now her teacher, her speech therapist, her occupational therapist, her PE. I'm everything for her. And she's not used to that. It's been really difficult.
And as we open up more vaccination sites nationwide, there's been concerns that we're losing some of our most prominent testing facilities. President Biden's promising to tackle that issue with the Defense Production Act to manufacture more vaccine doses and also millions of COVID-19 tests that could be administered at home. Eva.
Trevor Ault for us there. Thank you. Joining us now is Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia. Thanks so much for being with us this morning.
Thank you.
So you were on the FDA advisory panel that worked to authorize the Pfizer and Moderna vaccines for emergency use. Johnson & Johnson has applied for emergency use. So I'm curious, what will you be looking for when it comes to this one-shot vaccine, and do you expect it will be authorized?
Well, we will receive roughly an 80 to 100-page document from the company, which will detail all of the different phases of their trials, as well as safety and efficacy data. We'll receive another 100-page document from the FDA that will look through each of those different cases. There's 40,000 plus participants in that trial. The most important thing we look for is safety. We want to make sure that there's nothing about this vaccine that suggests it might be unsafe. And then we look, secondly, for efficacy to make sure that it is effective and effective in all groups, in all age groups, in all racial and ethnic backgrounds, and also with all sort of comorbidities. Then and only then would we recommend to the FDA that they approve this product through emergency use authorization. And even though it is this sort of unusual emergency use authorization, we really hold it to the same standard we would any vaccine, which is that would we take it ourselves? Would we give it to our family? And if the answer is yes, then we would recommend it for other people's families.
So let's talk about the state of the pandemic in our country right now. We heard about this in Trevor's piece. Hospitalizations are down in 39 states. It looks like we are past that post-holiday peak. Looking at the numbers we are seeing now, are we nearing the end of all of this? Do you feel positive about where we are in the country right now?
Yes, I worry about the Super Bowl because I think we didn't listen to public health officials regarding Thanksgiving or Christmas. After both of those events, we saw a bump, and I fear we're going to see a bump now because people are compelled to gather together in groups without masks or social distance. But I do think all in all, things are definitely getting better. We have 2 excellent vaccines that are out there. We have more than 30 million people that have received at least 1 dose, although that's not enough. It's a 2-dose vaccine. It's a start. We have more than 2% of the population that's gotten both doses. And we have, we say that 26 million or 27 million people have been infected in this country, but those are just people who've been tested and found to be infected. If you look at antibody surveillance studies, which is a much better way of seeing how many people really have been infected with this virus, because many people don't get tested, it's probably 3 times that. It's probably closer to 75 million, 80 million people. Now you're talking about more than 20% of the population that is essentially immune. And the weather's getting warmer, and you have an administration that is really dedicated to the science. I think we're on our way to getting on top of this virus.
Getting closer and closer to that herd immunity. We will leave you with that positive thought this morning. Dr. Offit, thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.